Good afternoon. I'm Linda Conley with Future Builders Inc. and we're with Dr. Bruce Randolph with Randolph Occupational Medicine Services. Dr. Randolph has agreed to share with us today why it's important not to smoke, and if you do smoke, why it's important to quit. We're going to let Dr. Randolph come in his own way at this time.
I was once asked recently, what advice would I give to a young person who's thinking about beginning to smoke? Young people often think that it is cool and hip to light up, especially when they're with their friends, out hanging in the club, maybe having a drink in their hands, based on the image that they see on TV oftentimes in movies. But I just want to advise a young person to think twice before they really start down that road. Matter of fact, there have been some rare cases where even smoking one cigarette has led to addiction. But most times it's over a course of time that people get addicted to cigarettes. Mainly because nicotine is a very addictive drug. It is as addictive, if not more addictive than than heroin. And so you don't want to start down that path of dependency and addiction. Because trust me, though you may be young now and you feel that, hey, I can smoke here or there, and I can still tolerate it, it won't bother me, if you continue. And I can advise you that most people who have addictions, whether it's to heroin, crack, cocaine, alcohol, or tobacco, they didn't just wake up and decide that, you know what, I'm going to become an addict. But oftentimes it's the result of a ongoing behavior that starts out occasionally, then a little bit more frequently, and then before you know it, it's all the time, and they have difficulty quitting. Nicotine is so addictive that I've had patients who've had one lung removed because of lung cancer still smoking. You ever ride around and see people in freezing weather outside hovering around trying to get a smoke? It's because they are suffering from nicotine addiction. It is very difficult to overcome that addiction. And one of the most challenging things that you would have people say, or that I often hear patients say, is that, you know, it's just so hard to stop this habit of smoking, even though it's killing me, even though it's adversely affecting my health. And the other thing that I find is that most of them would say that they started smoking in their teens. A lot of times they started smoking because they would light the cigarette for their parents, for their relative. So young people, if you really want to be hip, don't start. If you really want to live long, don't start. Because there is a direct correlation between mortality rate, longevity, and smoking. The next question that I was asked was, well, what advice would I give to a senior, an elderly person who is currently smoking? And I would advise them that the best thing that they can do for themselves is to stop smoking. It's never absolutely too late, but you can cause irreparable damage. And oftentimes I have patients come in who have smoked 2 packs of cigarettes for 20 years or so, and they are suffering from irreparable lung damage. Still, if they stop smoking, they can help themselves with some of the symptoms, but once the damage is there, it is difficult to completely recover, if possible, to recover from it. My specialty is occupational medicine, and so I perform disability evaluations. Often, almost every day, I have a patient coming in who have applied for disability because of COPD, which is chronic obstructive lung disease, pulmonary disease. And it is primarily related to cigarette smoking. Matter of fact, 90% or more of chronic obstructive pulmonary disease is related to as a result of cigarette smoking. And they primarily have problems such as chronic bronchitis, emphysema, and asthma. And these people come in and they can barely breathe. They often require oxygen as well as other multiple medication. And often I hear them say, I wish I had never stopped smoking. And so to my young people, don't start. To those who have started, I would advise them to stop, because it can help you. That's one of the best things you can do for yourself before it becomes just too irreparable. And so if you want to stop, call 1-800-QUIT-NOW. That's 1-800-784-8669. And you can be on the way to a better life and longevity. This is Dr. Bruce Randolph. May God be with you.